And the prostate cancer thing's interesting. Where did that come from, Keith?
Man, can I have the time to tell you
Please.
a story that
I think it's very
will shock
important
you?
because it's the most frequently mentioned thing at the GP's office is prostate cancer because these guys don't know what the hell they're talking about.
All right, I'm going to tell you a story of the androgen hypothesis, if you don't mind. And after I tell you this story, all your listeners will know more than their GP does, okay? But you're right. Prostate cancer is the number one fear for men before they start it, or reasons why they don't start it, as well as what family physicians will tell them, don't start it because you'll get it. So let's talk about that. So look, the belief for over 7 decades has been that high testosterone causes prostate cancer or increases a man's risk of developing prostate cancer, and that low testosterone was protective against prostate cancer, and that if you raise testosterone, you would cause an existing prostate cancer to grow rapidly, the equivalent of pouring gasoline on a fire. Who hasn't heard that? Now, where did this androgen hypothesis originate? It came from a paper in 1941 written by 2 urologists, Drs. Huggins and Hodges. Now, Dr. Huggins was a very well-known urologist, and in fact, he went on to win the Nobel Peace Prize in 1966 for his work with hormones and cancer. So a famous urologist. Now, in this paper, they looked at men with metastatic prostate cancer. Now, back then, there wasn't a PSA test, so they looked at something called a prostate acid phosphatase as a serum marker for metastatic prostate cancer. Now, in this study, Dr. Huggins reported that when men were castrated either surgically or chemically, the acid phosphatase levels went down. He also gave testosterone injections to men, and he reported that in every man that got testosterone injections, the acid phosphatase levels went up. That sounds bad. Now, this was an important paper at the time because, believe it or not, this was the first paper that identified a cancer to be hormonally sensitive. All right? The paper established 3 things. Number 1, that acid phosphatase could be used as a serum marker for metastatic prostate cancer, that castration was effective for metastatic prostate cancer, and that testosterone injections given to men with metastatic prostate cancer was dangerous. Now, when you take a closer look at this paper, you see that testosterone injections was only given to 3 men. Results were given for only 2 of those men, and one of those men had been surgically castrated, so he was no longer hormonally intact. He is what we would call androgen deprived. So the general conclusion that, and this is a quote from the last line of the paper, cancer of the prostate is activated by testosterone injections. This was based on one hormonally intact patient who received testosterone injections for only 18 days, whose acid phosphatase levels went up and down and were essentially uninterpretable. So decades of depriving men of testosterone was based on the overinterpretation of the results of one single man in one study. Okay, so you may wonder how that can happen. Well, in the 1940s and 50s, there weren't many physicians that had any experience using testosterone. You know, nobody had an adequate knowledge to question the results, so it became dogma that testosterone was dangerous for prostate cancer, and it's still thought that to this day. Okay, it wasn't until the 1990s that a Harvard urologist by the name of Abraham Morgentaler began to question the validity of the androgen hypothesis. In 1988, he actually started treating men with sexual dysfunction that had low testosterone levels with testosterone. Now, at that time, there wasn't any Cialis or Viagra, so, there really weren't any treatment options available. But what he noticed in the men that he gave testosterone, that not only did they improve sexually, but they improved both physically and mentally. Now, you got to think about it. This guy had to be brave because at this time, his treatment in those men defied standard medical practice, because in the 1980s, testosterone therapy was limited to 3 groups of men: men with congenital or genetic disorders like Klinefelter's, men with pituitary disorders, and those with absent testes. But he did become concerned because some of his colleagues warned him that he could potentially be causing harm based on the work of Dr. Huggins in 1941. So in 1992, he started performing biopsies on men prior to initiating testosterone therapy in symptomatic testosterone deficient men who had normal PSAs and a normal digital rectal exam. He wanted to rule out an existing prostate cancer before he gave him testosterone. What he found was that 11 out of the first 77 men that he biopsied had cancer. Now remember, testosterone was supposed to protect against prostate cancer. Low testosterone was supposed to be protective. Now, this percentage was almost identical to the percentage of men that have prostate cancer with increased risk factors like an elevated PSA or positive digital rectal exam. So low testosterone was found not to be protective. Okay. So what about high testosterone? I mean, could it be harmful? Well, in 2004, he published a paper, and prior to publishing that paper, he performed a world literature review from 1985 to 2004, looking for any worrisome relationship between testosterone and prostate cancer or testosterone therapy and prostate cancer. You know how many he found? He was unable to find a single article that testosterone increased the risk of getting prostate cancer or that testosterone therapy caused prostate cancer progression. Right.